Welcome to the Ask Chuck McKee YouTube channel. Today we're going to be talking about an amazing product called Onset. This is a buffering technique used to buffer the majority of dental anesthetics. We'll talk about the reasons why in just a few minutes, but right now we're going to focus on setting up our pen. The first thing we're going to do is we're going to take this little plug that we put in the back, and this is what houses any anesthetic we remove from our cartridge to make room for the bicarb. Just line up the indexes and you'll see it slide right in. Next thing we're going to do is we're going to take this 8.4% bicarb, slide that plunger side down into the mixing device. The next thing we want to do is we're going to make sure that plunger on the dose dial is pushed all the way back so we can easily screw this in. The next thing we're going to do after this is we're going to prime this. We want to make sure that our plunger makes good contact with the bicarb cartridge. Next, we're going to take our local anesthetic and we're going to slide it into the connector in the back. Once you slide it in, you'll feel a couple clicks, and then you're going to twist it, and then you're going to push it in, and that's what locks it in. Now we're going to take our dial and go to 9. Very important that it's 9 and only 9. Then we're going to push our button, and then we're going to reverse what we just did. We're going to pull the plastic connector out and twist back and pull back the anesthetic. This reminds me a little bit of our game like Bop It. Now, after 20 doses, you're going to notice that the bicarbonate has been used up. At this point, we just simply take the mixing pin apart and we reset this plunger by twisting the red dial. We want to pull that plunger back in so when we put our new bicarb cartridge into the mixing pin, we have room to reset the plunger. Next, we're going to pull this connector out. Press the two little tabs, pull it out, and we're going to throw that in the sharps container as well. Very important that we do that because all the extra anesthetic that we've removed from our cartridges in the beginning is now stored in that. So let's put that and the spent bicarb in your sharps. What's really cool about Onset is its stability at its 8.4% bicarb. Most companies have never been able to figure this out and how to make this stable. So what you'll notice is theirs is spring loaded into this box and packaging. Once you push down the tab and reset that, you have 7 days to use this drug. In most practices, that's about a week's worth of injections. Okay, so how do we know if this is actually working? The godfather himself, Dr. Stan Malamed, developed a pretty cool technique to ensure this. Basically, just take a little endo ice, spray it on a cotton tip applicator, and touch the tooth. You're going to know pretty quickly whether or not you have full pulpal analgesia at this point. On a block, we're noticing this is about an onset of 90 to 120 seconds if you hit your target. It's pretty amazing how fast this drug is. But let's talk about other things with this drug and why we would buffer anesthetic. I've never met a dentist who didn't give an amazing injection. Okay, if you didn't, simply you just wouldn't have a practice to start with if you hurt everyone who walked in the door. Buffering does a couple of things. My favorite thing it does is save you time. In an average practice that sees 7 to 8 patients clinically a day, not including hygiene, you're going to save about 35 minutes of chair time. Now, are you going to be able to measure that? Absolutely not. Are you going to schedule differently? No. But I want you to think about this as a speed bump in your day. So when you sit down to go to work, if you need to spend a little more time in hygiene, it's okay. So just know that if you have a block that you're getting ready to do, that 10 or 15 minutes that you usually sit there and let the patient marinate, you don't have to do that anymore. So think about this as a drug that throughout the day, you're going to make up a little bit of time. But just sit down and do the dentistry. Again, if we're doing a block, numb them, don't leave the room, and know you have confidence that in about 90 to 120 seconds, you're ready to go. The second thing is pain-free. The wonderful thing about this drug is we're truly buffering anesthetic. So we all know that they use different types of citric acid, and that's what causes the burn and anesthesia. That is a preservative that almost all anesthetics have. So when we do this is going to make this a nice, more comfortable injection. In a lot of cases, we see on a pain scale of 1 to 10 with a palatal, we're going to get you down to about a 2, which is pretty amazing for that injection. Now, I get this question all the time, what drugs can we buffer? You can buffer lidocaine and articaine. We do not want to buffer Marcaine because it's simply just too salty. Next question is, what is this going to cost? This is going to cost you about $385 to $400 a month in an average practice. But I want you to think about this not as an added expense, but more as a time savings. Let's remove a little bit of stress in your day, and let's give you a little bit of time back. If you have any questions about this drug, please feel free to reach out to me or any of your Patterson representatives. This is an amazing product, and I've had a lot of fun with this over the last couple of years. Thank you, and have a wonderful day.